Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tailored to a Hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, in the next series of Fast Facts, we're going to talk all about anti-infective agents. And there's quite a few that we use in dentistry. But having said that, I'm now going to contradict myself when I say, when it comes to antibacterial agents, our arsenal in dentistry is kind of small. What are the agents that we use for managing dental infection? Well, our mainstay are the penicillins. You know them as penicillin VK or amoxicillin. Most clinicians that I know use amoxicillin. Penicillin VK is considered narrow spectrum, amoxicillin is considered broad spectrum, but in many cases we think they're equally effective. All right, but what if a patient is penicillin allergic? Well, our usual drug or go-to drug is clindamycin. Now, the American Heart Association earlier this year caused quite a stir when they recommended that we move away from clindamycin when managing or prophylaxing for infective endocarditis, because clindamycin causes some pretty serious GI side effects. Okay, well, what did they recommend using? Well, of course, cephalexin or Keflex was on the list, but if a patient is allergic to the penicillins, there's a good bet they could be allergic to the cephalosporins like cephalexin as well. So the American Heart Association said, well, then maybe we could go with azithromycin, also known as Zithromax, or even doxycycline. Okay, but we don't use those in treating dental infection. Quite true. But that was the stir. So if you wanted to rule out what the American Heart Association's guidelines for infective endocarditis are, then the agents we typically use in managing dental infection are the penicillins, and if a patient is penicillin allergic, then clindamycin. Okay, but what if you can't use penicillin or clindamycin? Well, then the only other agent we have is azithromycin. Now, a lot of people call that Zithromax or a Z-Pak, right? So azithromycin is considered sort of second line. It's not top of the list like the penicillins, and it's also kind of dwarfed by clindamycin for those patients that are penicillin allergic. The last agent that I've ever seen used in dentistry, at least on a regular basis, is metronidazole, also known as Flagyl. Now, metronidazole is used in managing dental infections where there's gram-negative involvement. And so normally it's used as an adjunct agent. It's added on to, let's say, amoxicillin. So it would be amoxicillin plus metronidazole to provide coverage for both gram-positive and gram-negative aerobes and anaerobes. So quite an arsenal, although quite limited. And of course, we're going to make sure we use those antibacterial agents as efficaciously as possible. And that's going to be the subject of our next Fast Facts Pharmacology Edition. So my friends, until then, thank you so much for joining me today. Look forward to seeing you all again soon. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.